GLP1s, Ozempic, it's changing the procedures we do in plastic surgery. We're going to break it down full throttle next. Hey, Doc audience, you know, Ozempic, we call them the GLP1s, the weight loss pills, injections. It is totally changing the number of patients coming in for different procedures. We love data, Matt. You know, it's something that we look at all the time. So the data is showing, there's a survey from the American Society of Facial, Plastic, and Reconstructive Surgery that is commenting on the GLP-1s and that there's more facelifts coming in. It's a real thing that we're seeing as plastic surgeons.
It sure is. And, you know, really what the GLP-1 drugs have done for weight loss, you know, is made it much more accessible for patients to have medically managed weight loss programs. And so, you know, instead, you know, in the past, it was the case that if someone was wanting to lose weight, they're having trouble with diet and exercise or doing it themselves, essentially, really the only option that they had was to go see a bariatric surgeon and have a huge surgery, a costly surgery to try and lose that weight. Now with the ability to just take some medicine that can be prescribed really, I mean, online, you know, we're seeing it where, you know, providers are just having virtual consults with patients prescribing these medications. It's just very accessible for patients. And so, you know, for that reason, we're seeing a lot of the results of these medications with regard to skin laxity, volume loss in the face, volume loss in the breast, volume loss in the buttock. And so it's really, you know, made our practices a lot busier.
Johnny, you know, you're board certified in facial plastic surgery. You do really face and is your primary expertise. So tell us your perspective on this and what kind of face patients are you seeing coming in on these meds?
Yeah, so, you know, you definitely see more extensive loss of fat on the face. And what comes with that is now there's more skin laxity, which prompts you to do a little bit more extensive work. Because not only are you lifting the deeper layers, now you have to address the excessive tissue loss. But what happens is now you have less fat on the face. When you start pulling tissues back up, now you may have to necessitate with now fat grafting. So you're losing fat and then you're doing a facelift. Now you have to put more fat in. So you want to make sure you go to a surgeon that's, you know, equipped with different techniques to help you address these issues.
Roger, you know, what's your expert opinion on this? Particularly, it's not just face, you know, there's other body parts too. So what are you seeing and what's your interpretation of this trend?
So I'm seeing a lot of patients that are taking GLP-1s. You know, an important consideration is the fact that weight loss before surgery, we know lower BMIs, safer surgery, but it's also how quickly you lose the weight. And so some of these people, just like with bariatric patients, right? They lose weight really rapidly. Same thing with GLP-1s. Now that skin can't accommodate. So we really are dealing with extra skin. That being said, I do believe for a lot of these surgeries, whether it's face, whether it's tummy tucks, lower BMIs do typically lead to better outcomes. You know, something that we can't really fix with a tummy tuck is like visceral fat, you know, and that's kind of the Achilles heel of somebody with visceral fat. You do a muscle repair, they still have that epigastric fullness. I've seen GLP-1s be very, very successful in decreasing visceral fat. And I do think, you know, if done judiciously under a physician prescriber, they're a very positive thing for plastic surgery.
On that same point too, you know, I think what I'm seeing is that there's patients that may not even have an elevated BMI that are on a GLP-1 agonist, you know, and so really it's being used to help maintain weight as well. Also for patients that have like stubborn areas of body fat that just are not responsive to diet and exercise. I'm seeing, you know, patients that you would like, you know, almost be just surprised to hear that they're on GLP-1. I'm seeing that a lot.
Yeah.
And then, you know, patients are then subsequently having to deal with like losing fat, losing volume in areas that they didn't want to. You know, maybe it did help get rid of some of that periumbilical fullness or maybe the love handles, but then they also have volume loss in the face. And, you know, to your point, Roger, I think, you know, those are great patients because they're usually in pretty great shape. And, you know, oftentimes those are the patients that, you know, the patients that needed the least are the ones that are going to get the best results.
Roger, so if you're taking this, you know, and there's also, I've seen people like that really don't need to be on it. I think some of the things you guys are citing are great examples of how this actually is helping a lot of people. But there's also people that are like BMI of 21 and they just say, oh, I ate a little bit, I'm going to be taking this med. So it's a little bit, I see that and I find that a little bit weird. But in terms of the safety of these meds, like what are the things that doctors and patients should know about if you're taking these meds and you're going to have surgery, because it sounds like a lot of these people end up needing to have something done, then what are the safety things that you think are important?
The most common thing that I see when I ask patients, the side effects they have are GI problems. So nausea, vomiting, that's an important consideration with surgery too. We always kind of look at the drugs that people are on, and GLP-1s are certainly drugs that I recommend that patients stop before and after surgery because it can keep food in the stomach for longer. And if we're putting a breathing tube in, that does increase the aspiration risk. And also, with these GLP-1s, there's fat loss, but to everyone's point here, it's often indiscriminate fat loss. I mean, there's good fat and there's bad fat. Losing a lot of fat in your face isn't always a positive thing. And so we do kind of need to adjust what we do with these surgeries, fat grafting and things like that, to kind of accommodate. And so I would argue it's a great drug. And I see a lot of patients that have had bariatric surgery that rebound, and then all of a sudden they start a GLP-1 and they've been able to maintain their weight, which is great. But I do see a lot of 21-year-olds, BMI 19 on GLP-1s, and I would probably caution them against taking it.
Yeah, Johnny, how long do you make people stop before you'll do surgery?
Well, actually, when it comes to the face, where typically I like to see them bring in their pictures before they were on GLP-1 to see, to judge how much fat loss has occurred in the face. But, typically for facelifts, they don't, if I have them stop, is usually just the dose prior to their surgery.
Yeah, I think at least my anesthesiology group says 2 weeks is what I've done. But I don't know, what have you done, Matt?
I mean, I think bare minimum of a week.
Yeah.
But yeah, I think a lot of surgeons are doing 2 weeks. I mean, essentially that's just because the drug that as part of the mechanism of how it works, it delays food from leaving your stomach.
Yeah.
You don't want a cheeseburger in your stomach when you're going to have your face left.
Yeah. Okay. All right. Well, listen, great stuff. And this won't be the last time we talk about it, but I think that's some awesome information for our viewers.